Dus we zijn in de neuropathische ashram.
Neurotherapy.
Neurotherapy ashram. And so, but I want to say the name of the place is
Surya Mal.
Suryamal. We're in the neurotherapy ashram.
In Surya Mal.
Suryamal in the north of Maharashtra. About 3 hours drive from Mumbai.
Yeah, 3.5 hours.
In and out, how to call it? Sorry, my English is so poor. Not in a backward, but in a remote area.
Yeah, in a
remote area of Maharashtra, where Dr. Mehra founded this neurotherapy ashram. Could you say a few words about the word neurotherapy?
Yeah.
What exactly does it mean?
Yeah, neurotherapy, we are here meaning a therapy which treats all disorders, since most disorders have their final origin in the nerves. So Dr. Acharya Mehra of India, he coined this word neurotherapy in the year around 1976, and his students, we have a number of students practicing this therapy all over India, and it basically means we are treating diseases of all kinds without any medicine, without any external devices, just by application of pressure at certain strategic points, in certain specified sequences, for specified durations, and with specific combinations. A combination of all these things has been found to set right most disorders when given over a number of days and practiced over a number of time. This is basically what this Dr. Acharya Mehra's neurotherapy is all about.
Wonderful. We have understood that the therapy is gaining popularity, as you say, in India as a medical treatment. How do you see the future of neurotherapy in India and abroad?
I can tell about India. In India, the future is very, very bright because, see, this therapy does not require any capital investment. So, since most of India resides in villages where people have limited resources, and most people do not have much money to spare for medicines of the modern variety. So for such people, this is a veritable boon, a panacea we can say, where people get treated in their villages by their own local people and they get benefited. Since it's labor intensive, India being labor is quite abundant available. We have plans, we are already in the process of teaching people from all over India, from villages, from towns, and they come here to this ashram to learn the therapy, and from that they go back to their areas and they practice it among their regions, among the people of the regions. And many people are very, very successful. We have at least about 700 to 800 centers all over India where many people are getting substantial relief solely by this therapy without any medicines whatever.
Is it also spreading outside of India at the moment?
Spreading outside of India is not very large. We have a few persons spread in other places, like one of Guruji's, one of Dr. Mehra's old students is there in Canada, then one person is there in Adelaide in Australia, and a few more are there in some parts of Australia, but this is all sporadic incidents.
Just therapists, no real clinics?
Not real clinics.
And you spoke about the formation of therapists who spread all over India.
Yeah.
And what is the time you need to train a therapist?
See, since first let me tell you what the therapy is all about. The therapy is about giving certain sequential pressures in certain locations in the body. And by that process, we streamline the flow of blood, the flow of lymph, and the nervous signals. We streamline these activities in the body, and thereby the body sets itself right. So the basic process of learning how to give these pressure techniques, it has got two aspects. One is the theoretical aspect, and one is the practical aspect. The practical aspect is quite easy and can be practiced and learnt by anybody very easily. In fact, our present practice is, in our hospital, we teach the relatives of the patients so that when they stay here for about 2 to 3 weeks, 3 weeks is the average time for patients to stay here, then they go back to their homes and their relatives continue the treatment under our guidance. And by this, many difficult disorders, we have found substantial and spectacular results in the patients. And the same thing, the people come here to learn. They stay here for between 4 to 6 months to learn the primary practicals and a little bit of theory. And then they go back to their centers, and then there is an ongoing, continuing process of keeping in touch with us. Many students keep in touch with us. Number of people don't also. So it's not that we have total control over all the 600 centers, but people keep in touch. And then we tell them, since the basic pressure points are the same, then as and when a particular difficulty arises in a particular disease, then the student rings us up, and then we guide him from here how he can tackle it.
Constant guidance of all the therapists.
Yeah. Any student who has learned from us, whether it is a student, actual student, or it's the relative of the patient, they are completely guided by us. Whenever they have any difficulty, they can approach us, and they do approach us.
And as I've seen in the ashram, it happens that people come with members of their family, and you train those members to give
right.
the therapy to their family members.
Yeah.
Wonderful.
So that's what I said. Since it's a pressure technique, and the pressure technique is quite simple, and it is unlike other acupressure or acupuncture where the pressure points are very specific. Here, since we are diverting or we are modifying the flow of blood, the pressure area is larger, so anybody can easily pick it up. We are not working on very specific points. We are working on broad areas of the body where we apply pressure for certain specified sequences of time. And when we apply pressure at one particular point, then pressure at some other point, the blood flow or lymph flow increases, and that streamlines the problem in that area. Dr. Mehra's expertise is to know very accurately which pressure applied at which point will set right which organ better. For example, our pressure points are all named in terms of the organs of the body. We have a point called liver. So when we apply pressure at certain points in the body, it has been found that it is useful for all liver disorders. So irrespective of whether it is hepatitis or whether it is cirrhosis or jaundice or whatever, or fevers, anything can be treated by that particular treatment, and the results are there for anybody to see.
And are there specific points to treat heart diseases?
Yeah, there are specific points for most disorders. There are specific points, but primarily when a patient approaches us for treatment, we don't immediately treat his disorder. It's our understanding that all disorders primarily stem from a disturbance in the abdominal organs, in the blood flow to the abdominal organs. So first, that manifests itself as disorders of digestion primarily. So whatever be the other disorder, unless and until the root cause is set right, the disorder can't be tackled permanently. So we go and tackle the root cause by setting right the abdomen first, and then depending on whatever the disease is, we have other points, additional points to set right that disease.
Does neurotherapy also has a psychological or spiritual approach of the patient's problem?
The spiritual approach is at present not in that sense. We have a technique by which when we want that the therapist should be totally dedicated to treating the patient as an entity. That's the lingering thought which is in the minds of the therapist, which we instill in them. And otherwise, spiritual dimension, it is not necessary whether the patient is spiritual or whether the therapist is spiritual. It's not needed. But such things always help, because almost all disorders have the root cause in the mind, so psychosomatic disorders. And there, the spiritual entity or the spiritual faction is always beneficial.
Frank, how do you experience the treatment yourself? Did it benefit you?
It is for sure relaxing. I came here with a bit, I was stressed when I arrived, but of course we are in the middle of the green surroundings in a remote area. And this is very helpful as well, I think.
Yeah.
Nature works combines well with neurotherapy. That is what I believe. The combination of nature and this mild, very mild therapy is beneficial to me, yes.
But what have you had any specific benefit from your condition, any particular thing which you would like to narrate, which before coming you had a difficulty and you faced some improvement in your hand or leg movement or whatever?
Well, I had my 4 limbs were weakened by multiple sclerosis, and I must say walking has improved, my balance has improved, and specifically the biggest improvement was in my left arm, which I had difficulties in stretching out my left arm without shaking, and I can hold it steady now.
Earlier you could.
No, it was difficult.
Hand would shake.
The hand would shake, and now it doesn't shake anymore.
Now you can show. Can you show whether your left hand? This was
when I arrived here, it was like this. And now I can just stretch out without. This is the most important benefit, I think. Another benefit, my confidence in the therapy grew. And I think that is a benefit as well. So my future looks a bit better.
Yeah. It's definitely better. See, we are talking of multiple sclerosis. Multiple sclerosis has got various types of symptoms in different people. Not all people have similar symptoms. But we have found out that by our combination of pressure therapy and allowing the patient to relax in these sylvan surroundings, we have found number of people getting benefited not only from multiple sclerosis, muscular dystrophy patients also get benefit, schizophrenia, and mental disorders such as mental retardation, children of mental retardation, autism. Even in autism, the benefit comes after a long time, about 9 to 10 months. But the advantage is that the patients, the relatives of the patients, they learn the therapy and they give it. And if they have the confidence to give it, and they develop the confidence by seeing other people here, they develop the confidence. And when they give it and they start giving it with love and affection, we have found that in a number of cases, within 4 to 6 months, many children have become quieter. At least their hyperactivity is substantially controlled. And later on, within 1 or 2 years, they are very, very, very manageable.
Okay, one scientific question. How do you come to know that by certain pressure, specific hormones are released? How do you scientifically come to know this?
See, the thing is that when a particular medicine is given, it's given based on what effect it produces, isn't it? So when we see that a particular disease, let us say, take the case of paralysis. We see the paralysis is due to a blood clot in the brain. One of the reasons of paralysis is a blood clot in the brain. Another one is called hematoma. One is called an infarct, another is called a hematoma. So let's say a blood clot in the brain and causes paralysis. And we have got a particular treatment which we call heparin treatment. I mean, it's just given a name heparin because the action of that treatment simulates I will not say we have not tested it whether it makes heparin or not, but it simulates the opening of the blood clots in that within 1 or 2 days the paralyzed person feels at least 25 to 35% better in 1 or 2 days. After that he continues the treatment. So we have given certain names to facilitate. For example, if we find a particular patient is having a lack of calcium, and then we have a treatment which later on increases the calcium in the body, by 2 or 3 treatments we can see that the calcium level goes up. Then that treatment has been given a particular name which is associated with calcium. So like that. But none of our treatments, since hormones cannot be easily tested in the body, we haven't made any such tests. But the patients vouchsafe for the success of our therapy.
Acharya, you were very enlightening, I must say. Thank you for this interview. And we wish the ashram all the success.
And I wish you personally improvement in your condition. I'm sure when you leave, you will be much better than you came in.
Thank you.